Justin Clancy, member for Albury. And Ellen, I might go to you for eyeline if that's all right.
I might just stick that there, Justin, out of your way. Is that in your way?
No, that's all good. Thanks, Ellen. Look, welcome everyone firstly, and thanks for being here today. In introducing the New South Wales Chief Health Officer, Dr. Kerry Chant, I do want to say thank you to Dr. Chant. Earlier this week, I spoke to Kerry. We talked about the concerns and challenges that our community was facing, and at that point, Dr. Chant made the offer to be here on the border. Less than a few days later, Dr. Chant is here with our community to hear firsthand about the challenges we're facing. And I think it's really important from two perspectives in that regard. One is for our community to know that its concerns are being heard at the highest level, being heard by none less than the Chief Health Officer of New South Wales. The second is I know that Dr. Chant will be able to share insights from New South Wales Health's perspective, but also will be able to gain insights from being able to directly relate to our local community, to hear firsthand from them. And those insights will go on to impact how we manage this, will benefit our community, but hopefully will also benefit the wider community as well. So we're going to turn firstly to Michael Kalimnios as CEO of Albury-Wodonga Health to give a brief update on overnight from Albury-Wodonga Health's perspective. Jill Ludford as CEO of Murrumbidgee for a brief update on Murrumbidgee's side of things, and then we'll turn to Dr. Chant. Thanks everyone.
Excuse me, just get my numbers. Thanks, Justin. Michael Kalimnios, CEO of Albury-Wodonga Health. Just some updated numbers in terms of the public health unit on the south side of the river from Victoria. We had 52 new cases overnight, up to the 24-hour period to 8 p.m. 45 of those were in Wodonga, 6 in Wangaratta and 1 in Indigo. We now have 371 active cases in our northeast Victoria catchment. We conducted 817 tests yesterday, and we thank people for coming out and getting tested, and we administered 458 vaccines. Just in terms of the impact on the health service itself, we're currently managing 580 COVID patients in the community across the border, and that's both across our New South Wales catchment and Victorian catchment. We've got 7 positive COVID patients in hospital at the moment, and one of those patients is in ICU. So I might just hand over to Jill to give you an update on the New South Wales side. Thank you.
Okay, good morning everybody. I'm Jill Ludford, the Chief Executive of the Murrumbidgee Local Health District. I'm here today to provide the information about the public health cases reported today across the Albury Local Health, the Albury LGA. So today we're reporting in the greater Murrumbidgee area 52 new cases. 46 of those cases are here in the Albury LGA. There's one also in Cootamundra-Gundagai LGA, one in Wagga Wagga, one in the Murray River LGA, one in Berrigan, Federation, and one in Greater Hume. Sadly, I have to report today that a man in his 70s has passed away yesterday as he's acquired the COVID infection. He had received 1 dose of the COVID vaccination, and I extend my heartfelt condolences to his family and friends and to the community. So during this outbreak here in Albury and Wodonga, it's really important that our Murrumbidgee Local Health District and my team work alongside Albury-Wodonga Health, who are the healthcare providers for these communities. And I do want to acknowledge the magnificent effort that they are doing in caring for Albury and Wodonga during this really difficult time. We are partnering together in the public health response, and I'm really pleased to say that both sides of government are very keen on sharing and exchanging information so that we can get a really good picture of what the outbreak looks across Albury-Wodonga and not just in individual states. We are also working with integrated services to make sure that we have one response. And it's clear when you have a look at the breakdown of the cases that the majority of the cases in this region are in young people under the age of 19. Therefore, our strategies in both of the communities needs to be about vaccinating children who are eligible over the age of 12. And Albury-Wodonga Health and my team in Murrumbidgee Local Health District have developed a plan where we are going to ensure that we increase the vaccination rates as quickly as we possibly can, because that is how we are going to protect our communities and learn to live with COVID. The other vulnerable groups obviously are aged care facilities, and we're seeing at the moment an outbreak in 2 aged care facilities in New South Wales, in Albury. And New South Wales works very closely with the Commonwealth Government under the joint protocols, and Murrumbidgee Local Health District is providing senior public health response and leadership in that, and also expertise in infection control and prevention. New South Wales Government has increased and provided additional supports in public health to enable us to do timely contact tracing during this time, and we also have a senior epidemiologist who has joined our team. But most importantly today, I'd like to welcome Dr. Kerry Chant, because it's really important that we improve our messaging to communities and communication about how we move now as a vaccinated population into living with COVID. So I'll introduce you now to the New South Wales Chief Health Officer, Dr. Kerry Chant.
Excuse me, can you just confirm the death was at Mercy? Was it connected to the Mercy?
Yes.
Yeah,
Yes,
so
thank
that's 3 now.
Yes, correct.
And which is the second?
I'll take questions at the end. Let's let Dr. Chant speak first. Thank you.
Thank you very much, and can I just say I've only had the opportunity to walk briefly around this beautiful town, but my congratulations on what a beautiful town it is, so thank you. It's a pleasure to be here, even if it's a little bit chilly if I'm shaking today. It's not because of the questions, it's because of the breeze. In terms of overall, I think it's important that we sort of set the scene. Across New South Wales, we have reported 268 locally acquired cases. And what we are seeing is that we've seen an increase in the proportion of those cases that are regional. It's really pleasing that we've got down to these low levels, and this means that we want to actually maintain the levels of case numbers as low as we can. But accept that we have changed from elimination as our aim to actually living with COVID. And we can do that because we have access to vaccines, which reduce the severity of the disease. And also, they do have a role to play, because if you're vaccinated, you're less likely to contract the disease and maybe less likely to pass it on. So it has that a benefit of protecting those around you as well. We also have new therapies for COVID treatment, and we have high quality care. And now is about moving into a phase where we need a proportionate range of responses, proportionate to the level of infections in the community. So we get to that nice sweet spot. Now, I'm not saying I have the journey is plotted ahead. COVID has thrown us many curveballs, and we'll need to continually learn from the international experience and our own experience. But what we know is that vaccination works. The experience we've had in aged care facilities is very different to what we saw in earlier waves because of the effectiveness of the vaccines. But what we also know is that COVID is very good at seeking out unvaccinated pockets in our community. So whilst when I was being briefed about the Albury, I was so joyous at your high rates of first dose coverage, because I'm sure that second dose coverage will similarly be very high. It's critical that we support all within the community to be vaccinated. And I think everyone's got a role to play in that, but we've got to make vaccination easy. We've also got to explain misconceptions. People can still, I can give some anecdotes of even my brief time here in terms of interaction with people, that there still are concerns that the vaccines may cause infertility, impact or have other side effects or change genetic. I can be absolutely clear. There is no evidence to substantiate any of that. And individually, I would just like to affirm that my advice to all of those loved ones that I care about is to be vaccinated. Vaccination, I will not always, there are risks and benefits associated with any medication, vaccine, so I'm not going to walk away from the fact that there are side effects, but they are very rare, and in proportion to the impact that COVID has, for me it is very clear cut that vaccination is what everyone should undertake to protect yourself. Also, Antigen and the Commonwealth Government announced that there will be booster program. We did vaccinate a number of our healthcare workers and our aged care residents over 6 months ago, and some of the data suggests that even though the vaccine holds up pretty well, the advice is we now could boost those individuals to give extra protection. Also, a few weeks ago, Antigen again gave guidance that people with underlying immune conditions, so conditions that meant you might not have mounted a good immune response to that 2 doses course, need a 3rd as part of your primary course. So what we're trying to do is keep the disease burden in the community very low, whilst we just give everyone as much opportunity as we can to get vaccinated. And overall, we'll try and keep cases at a level, but we may actually be comfortable with the cases being a little bit higher because we see that disconnect. Vaccinated people can get COVID, but it's usually a very mild disease and they can transmit it. So we'll continue to need to be vigilant and continue to have those public health and social measures. So don't go out and about when you've got symptoms. Mask wearing indoors is good protection, and we'll probably increasingly give tailored advice for those that are most vulnerable in the community about the sort of practices that they can undertake to keep themselves safe. So this transition period's been quite a complex one in the sense that information's been rapidly evolving, and I just want to apologise for the community in terms of we want to engage with you about how we can improve the clarity of that communication, but we are having to change all our approaches, and the legacy of what we did maybe 2 months ago is very real, and we need to now change to what contact tracing looks like in the future, what a close contact is in the future, and how we take into account vaccination and other mitigation strategies in our approach to actually enable a proportionate response and work with the community, as I said, to keep case numbers low and keep the mortality and the health consequences of COVID as low as we can, but allow the freedoms and manage health overall, mental health, economic well-being as a package, and get that sweet spot. And as I said, I haven't got the perfect answers as we go through it, but I'm sure the community has been incredibly resilient and incredibly happy to be on this journey with us. But I do undertake that we need to do better communication in this transition period, and I apologise to anyone who's had confusing messages, but we will do better. Thank you.
Ask a few questions, Kerry, just on the communication. How closely are you communicating with Victoria? Because obviously being in a border town, particularly when it comes to schools, there's different messaging for parents and children in terms of isolation and testing requirements when you're in New South Wales versus if you're a student in Victoria. Is there any indication of those rules lining up for border towns, or I guess across both states?
Look, it's really pleasing. We've set up a joint outbreak management team across the two because, as you said, we have to treat the towns as one, and that goes for the whole border communities. From previous, I'm aware of how close the interaction is between Victoria, and I know how Melbourne's only 3 hours in that direction. So I'm very conscious of the fact we need to be consistent. We are working closely with Victoria public health officials, and we'll move. But as I said, we're all moving, and we're trying to get that alignment. And if the community can just have forbearance with us as we try and adjust those settings, but we will endeavour to land in I think ideally in a national way, to walk back some of the requirements, particularly taking into account vaccination status. But my key message to parents is, if you've got a child that's over 12 years of age, please go and get vaccinated, because going forward, high schools will be very, very much safer when everyone in those is vaccinated, and that will then protect anyone who, for various reasons, is unable to be vaccinated at that time. So it's really critical that we do that. And why we're particularly worried about schools is, whilst generally, particularly primary school children, get very mild disease, they then can take it home to other households, and if that household isn't vaccinated, it can set off a whole chain of transmission. So clearly, us making sure we do everything we can to make sure that there's high vaccination coverage, particularly in the younger age group. What we've learned is that age group, from that 12 to 40-year-olds, contribute a lot to transmission. And our COVID data overall has shown that younger people are overrepresented, and younger people have more social contacts. So every individual person that is in that age group is likely on average to interact with a larger number of people compared to older cohorts, and so they can drive transmission, and therefore having them vaccinated, the modelling shows that that's an important strategy for keeping case numbers as low as possible.
Based on your knowledge of the situation here in Albury-Wodonga, do you feel as though there's sufficient resources to combat it and then get on top of this?
Look, I've been really pleased to be at one of the local emergency management committee meetings, which are clearly working across the Albury-Wodonga. I know that there's a number of other committee meetings today to thrash out some additional actions, particularly focused on getting those vaccination coverage high, particularly in our school students' populations, but also any other vulnerable groups. So I'm confident that there are plans and the priorities is there to further drive vaccination coverage, make testing easy, and reach communities with the messaging. But everyone has a role, business has a role, the community leaders have a role, church leaders. I mean, I think it's really important that we talk as one about the key things that are going to keep us safe.
Just in terms of the size of the outbreak here, if you look at it on a per capita basis, is it fair to say that the Albury outbreak in some ways is just as large as what you have in the CBD of Sydney?
The Albury outbreak is significant. I'm also keen to, in talking to the team, to understand the drivers of it. It's a very young demographic, and I think what was interesting, we were just talking about how young the population of Albury-Wodonga is, how many new migrants you've had to the area, how it's attracted young families, and I can understand why. It's such a beautiful part of the state. So I think those factors are potentially the reasons that are contributing to the transmission, but I'm very confident that with the actions that people are putting in place and the goodwill of the community, we will be able to get numbers down lower.
But if you look at it on a per capita basis, is it like we've got 3,000 cases because of, the size of our community compared to yours?
Oh,
in
look,
Sydney?
this is a significant outbreak. We're also, the other areas that I'm concerned about is obviously we've got case numbers quite high in the New Hunter, New England area, and I'll certainly be also taking some learnings from that area. But what I also would like to say is that we've seen these cases rise, and we know what works in bringing case numbers down. Many other sites have put in a suite of measures, so I've got absolute confidence the suite of measures works, and I've got absolute confidence in the community. I would also like to commend the community for the adherence to the COVID safe measures and the mask wearing, the QR check-in. My limited experience here has shown how seriously the Albury community is taking things, but I think it's also important to talk to the community that we are moving into an endemic phase of COVID, and so we again need that proportionality. Why we're trying to particularly suppress the cases and get the case numbers down low is that we know there are still unvaccinated pockets, and we just want to minimise harms. But once we get a highly vaccinated, uniformly vaccinated population, even if we had similar case numbers, we wouldn't be as worried because we would have less vulnerable people left.
Have you seen a similar outbreak in schools in another regional area compared to this one here?
We have seen in southwestern Sydney. It's hard to sort of compare because we've been in lockdown in Sydney, but we still had
in a comparable regional setting, maybe.
certainly in I would sort of draw the exemplar of Dubbo. Dubbo was a case where we had amplification in the schools and amplification in some of the extracurricular activities, and there was actually, and in some of the smaller Western New South Wales towns, there's also been a number of schools involved. For instance, in Walgett, and another message to parents is one of the other things that you can help us with at the moment is I know your children love doing all of those extracurricular activities and mixing, but could for the next 2 weeks everyone just keep those children reading those textbooks, or that's very old fashioned, online in terms of the tasks that you've been set by your teachers. We just want to minimise the interactions between students, and obviously people have close friends, but let's not try and extend those out into sort of big sleepovers, big parties, just for the next couple of weeks, just so we suppress it and we get time to just mop up that last group of immunisation. I mean, the vaccine work very well, and in the 12 to 12 years age group and above, they will be highly protected very rapidly after the couple of doses. We just need that time to get it into them.
Kerry, there's a large sense among the community that Albury has been left behind compared to Sydney counterparts. From what you've seen this morning, do you think that that's the case?
No, look, I've seen an incredible commitment across the two services to work together. I think that COVID always seeks to find weaknesses in any system, and I think this will be an element that we'll have to have for years to come. You know, we'll need to make sure that we're reaching all components of the community. You know, if it is people getting translated material and interpreters to help them navigate the system, if it's just people that have, can't get time off work, or people that are unaware of how to access vaccinations, the simple things like making it clear that it's free. We don't care if you've got a Medicare card or not, just come and get vaccinated. I think it's about the intelligence we get from the community leaders, business, to tell us what are the barriers to people doing, because everyone wants to do what's right. Everyone wants to keep themselves and their loved ones safe. We just need to understand what we maybe need to do a little bit differently in order to support people to get vaccinated. And as I said, this is not only our responsibility, it's everyone's responsibility to really make it easy to get vaccinated and continue to adopt those COVID safe measures. It's really important that workplaces don't encourage people to come to work if they've got symptoms. You'll end up with a outbreak, in your workplace, even if you've got a fully vaccinated workplace. So some of the things that we've put in place, we're just going to have to embed and stick with. Other things we can drop. We've dropped outdoor mask wearing in general, because that's a lower risk of transmission, and we want to get to this proportionate way. We only want to ask the community to do what they need to do. But as I said, the reason we're being so aggressive at this time in the response is really about just buying time to allow us to get those vaccination coverage levels up and make sure we've protected as many vulnerables. We've got our booster doses in. We've protected our immunocompromised people with that additional dose, and done everything we can. And then we'll still need some safety measures, but we'll probably have to get used to case numbers being higher than what we've traditionally heard. But those people will probably have very mild illness.
Do you think that Albury's case numbers have peaked? Have we seen the peak? Are we on the downhill now, or is it worse to come?
One day does not make a trend. The number this morning was a lot lower than the number they've had previous mornings, but as I said, I'm very loath to say one number makes a trend, and I'll see where it lands in the rest of the day. Testing is lumpy. And also finding cases is actually a good thing, because it allows us to do the public health intervention around them. So can I just thank the Albury community for coming out in testing? That's an amazing effort, because again, that action will protect us.
Is there a trigger for a lockdown at any point?
I think that we need to understand that we've got a lot of controls in place at the moment. So only vaccinated people are allowed and permitted to go to a number of settings. We've got indoor mask wearing. When I've been walking around the various accessing breakfast and a couple of other things. People have been very, very diligent about it. So we've got these other layers of protections. We don't preclude anything, but I think it's just about us again being proportionate. Our main focus now is finding undiagnosed cases, isolating those, and then getting those vaccination coverage up very high as quickly as we can.
Are you concerned at all? Obviously, the source of infection for the outbreak here is unknown. Are you concerned that, I guess, in that fact itself, or the fact that we can't find the initial source of infection?
Look, that doesn't worry us at this stage in the outbreak. What we're more concerned about is what's here and now. Are testing levels high? Are we reaching all sections of the community? Are people that we've identified as close contacts getting tested? So it's a different phase. We're not necessarily always trying to find what's introduced a case. We're trying to just manage case numbers, keep them down. Into the future, we'll be interested in things like whether we've implemented all the recommendations about boosters, have we got high enough vaccine coverage, are we getting disease in a particular group in the community, and that might trigger that there might be a group that hasn't been reached by vaccination and it means we've got to redouble efforts. We'll be looking at hospitalisations and ICU admissions. So case numbers will become less and less relevant. And one of the challenges will be sustaining people's testing behaviour. So again, we'll need to use the rapid antigen testing and a lot of other techniques and really navigate the future. But case numbers in itself won't be the key driver. We'll have to look at, like we do always, a suite of measures.
There's been a change in the publication of exposure sites now going to an app-based system. We live in a country area. There is some, It might be a younger population, but there is still an older generation who's potentially are telling us that they're struggling with that technology. Is there any thought of changing that back or making that simpler or easier for them, that demographic of people?
So we've been doing a lot of work at looking at what venues where we do get transmission, because one of the things that we learn is the more you tell people about things and bombard them with lists, they get fatigued. They don't look at the list. And so we've been doing a bit of work which looks at where we're actually seeing transmission. So supermarkets we're not seeing transmission. We're not seeing transmission in news agencies. We're not seeing transmission in a lot of sites. So we're going through and saying, well, where are the venues that we're really seeing transmission? So we are evolving what we put in exposure venues, and we'll probably move to a site where we only just give information on where we know there's been transmission at venues. And the reason for that is the people that you're most likely to infect if you go to, for instance, a restaurant or a pub or a club is the people in your social group, and they will be picked up by the individual contact tracing. So when we call a case, we ask who you've spent time with, and that will pick up those people that are most at risk. Then if everyone else at the premise has, taken the actions we encourage you to do, then those risks are very low, and it would just be requesting you to monitor for symptoms. And if that's the case, we'll ask everyone to monitor for symptoms. So I think we have to work, rather than, it's a challenge of just overwhelming the community with lots of information where they'll get fatigue. So this period of transition, we've also got to think about what is the things that we absolutely want the community to do, because otherwise we risk them not doing anything and being overwhelmed. So it's a tricky bit, but that's our logic now, that we're moving to probably focus on where we've got transmission, and then focus on the close contacts and household contacts, which are the close social contacts, are the greatest people at risk, and obviously workplace contacts in some situations. Because what happens in workplaces is there's an interaction between workplaces and social contacts, and so what we find is it's not so much about transmission in workplaces, it's where you let your guard down in the tea room, or it's the informal gathering that you have associated with the workplace, because obviously we're all social creatures and we all let a guard down at some time.
On schools, we're hearing from parents that there's a bit of a delay in their child being identified as a close contact. They're being told, but then they're being told the exposure was 5, 6, 7, 8 days ago. Is it fair to leave that sort of contact tracing up to the schools? And I guess, how can we speed up that process?
So we have a process where, look, there can be some reasons for delay in the fact that a child may have had symptoms for a bit longer, and we go back and the test takes a day or so. I wouldn't have liked it to be 8 days ago that we're doing that. We certainly need to do that promptly. But there will be some reasons why you're designated as a close contact, and it may be relating to an exposure 3 or 4 days ago, because you are infectious a couple of days before you've got symptom onset. And even if the child was taken out immediately with the symptoms, it then picks up. The child will be then potentially infectious at school. So there are some inbuilt delays, and so people need to understand that's just how it is going to be. We do need to work. Health works with the education department, but schools have the list of people in the classes, and parents are very used to getting information, and we do want it to be as quick as possible. We're moving now to much more focus on classes and trying to minimise the impact on the whole school, and also speed up any cleaning processes so that we can support the operations of schools, because we do believe that schools, it is important that we keep children in schools.
Kerry, additional freedoms are set to trigger on December 1. There is word that people would like that to actually be around the 95% vaccination mark. Do you have any thoughts of whether that may be the case?
I'd love to get to 95%. We're sitting at 93 point something, so please contribute to that next bit. Look, I think from my perspective, there is significant uncertainty in how the numbers will go. And I think that we've got good settings in place. Let's just see how it goes. We obviously review it week in and week out, and obviously keep it closely monitored. But it is important. It sometimes takes a couple of weeks. We've only opened up at the 11th of October, was the 70%. The week after was the 80%. So sometimes it just does take us a little bit of time to see. But I just want to thank the community for their adherence. I mean, I'm actually really very pleased that our case numbers are where they are. But it's going to be, we would like to see them as low as possible, just while we mop up the last groups that haven't had the opportunity to be vaccinated. And we can do that quite quickly. We have great vaccines, great vaccine access. We just need to work really hard as a community to make sure we leave no one behind and strive for that to be the most vaccinated country. I've got to say, ACT is doing brilliantly, so just as a bit of a niggle, let's get up beyond ACT. I know that's a hard ask, but let's get there.
Thank you.
Justin, can I just ask you about the rapid antigen in schools? Would that be all right? Would you welcome getting the rapid antigen trial
you
in
could
schools?
ask Dr. Chant if you like.
She wants to ask whether you're welcome.
Oh, sorry.
And I need a different talent for the story.
You need different talent. You've got great talent there. So
You'd certainly welcome a trial in Albury schools for rapid antigen to get kids and teachers back to school earlier?
yes, certainly welcome it. We've obviously had a very disruptive fortnight for our students firstly, but also for parents, mums and dads out there, teachers and principals. We need to be looking at ways of reducing that disruption. We know the challenges of the testing wait time, so if this is helping to reduce disruption, then it's something that we should really be welcoming.
What's the process of how they'll be distributed? And, is it all schools, or is some set aside for business, or what's this?
Yeah, firstly to that, David, part of that will be Dr. Chant will be discussing with principals this afternoon, and in that sense we'll also then make sure that information is further shared out as we gain an understanding from Dr. Chant around the process. My understanding is that there will be two components, a surveillance component across the schools, but also then targeting the closer contacts. So, as said, that information will be distributed to principals. They'll make sure that they're communicating out to their school communities, and we'll look to do so as well.
Can you return to school with the rapid antigen testing? I know some schools were getting notice that you could get one, but if you returned a negative result, they wouldn't accept you back into the class cohort. So will that be something that's changed?
Yeah, that might be detail that Dr. Chant can answer in that regard, but my sense of it is that there'll be a process put in place. And I think the other part to what Dr. Chant's also indicating is that as we move through this, that process may evolve based on the information that they're getting back in terms of how it's responding in school communities. So I think my comment to our community as well is that this is an important step forward. We're looking at ways of reducing the disruption, but having said that, like any new innovation, we should also expect that there will be challenges as we introduce that process and as we embed that process.
Could we just get an answer on that one? Some schools were sending out notification that kids could get a rapid antigen test, say on day 13 tests, but wouldn't be able to return to the classroom if that was the case. They had to get one of the standard tests to do that. Is that rule changing? Or?
So there's different groups of individuals. So there's close contacts, which are the close contacts of a case, and so we do recommend the PCR testing for that because of the fact that it's a more sensitive test. The way we're using rat testing, the rapid antigen testing, and it is a work in progress because we just need to work in partnership with parents and the principals, is whether it gives us early warning. So we've used it in other settings like aged care and disability, so that people do the test and then it gives us an indication of whether they're positive. If it's positive, it still could be a false positive, so it still may be not a real positive, and so we're setting up processes for them to be able to get rapid confirmation of that. And the aim of that is that we reduce the likelihood that there's an infectious child at school, and therefore any of that other flow-on impact. So that's one way we're using it. And then the other way we're using it as a way of reducing the time that a child has to be off if they're a close contact. So we're working through those issues, but this will be learning, and it'll be learning in partnership with principals and parents. We're not expecting this to be a long-term strategy, but just, again, a short-term strategy to try and minimise any disruptions to school as we keep schools open.
So the 30,000 kits or tests that were made available, announced this week, they're predominantly going to schools, not businesses, or a combo of both?
They're predominantly going to schools.
Yep.
Obviously, having access to rapid antigen testing, there are being used in our aged care facilities and other facilities. We need to learn how to use rapid antigen test. We need to understand its limitations. They're not recommended for people that have got symptoms. It's recommended that you get the more sensitive PCR test. But increasingly we'll learn how to use rapid antigen tests. We have used it in other business settings, in other sites where there might be an outbreak, and it might be so critical that you keep some staff to work that may be sort of casual or close contacts, and so we have used it, but this will be a work in progress to figure out what are the use cases for the rat. But we also have very good access to more rapid testing, and again that's evolved. Wagga's got rapid testing, and we've got regular courier runs to Wagga, and that really does reduce the turnaround times, and the performance at turning around times have been quite good.
Tracy, could I just ask you a question about the New South Wales Services app that we spoke about earlier on in the week, whether the alerts have been added back onto the New South Wales Services app? Question for a colleague, Tracy. Do you know, Tracy, whether the exposure alerts have been added back onto the New South Wales Service app?
I understood Kerry, the Service New South Wales alerts have been added back onto the app, haven't they?
Yes. So the process is we are just putting the exposure. As I said, we're going through the exposure sites and not putting up exposure sites at supermarkets and things where don't have a lot of experience, and this is experience across the state that we haven't seen much transmission. But there will be a process where Service New South Wales goes through the app, alerts people with a notification. And again, this will be a process where we'll have to review that as well, because again, the point I made is if people are getting a lot of notifications, they might not attend to the ones that are important. So again, this will be a bit of a work in progress, but the key will be just reducing the noise for people, making sure we're focusing on giving them key pieces of information as simply and clearly, which indicates what action they need to take.
So currently, if you do get an alert, you should follow that advice on that alert.
Yes, but as I understand it, the Service New South Wales is generally going to be monitor for symptoms, and everyone should be monitoring for symptoms. So again, we'll look at the utility of that as we move through, what people are finding useful, and our focus though will be potentially on moving to more what are the transmission sites, you know, where we've actually seen additional cases, and that's probably where we will end up. But at the moment, we're trying to use multiple different ways to communicate. But in the end, we're conscious that we don't want to overwhelm the community with lots of information that just reminds them to monitor for symptoms, if in fact we're asking people to monitor for symptoms anyway. So again, work in progress, but it will be based on what consumers find useful, and we'll try and put that in a very user-friendly way.
Thank
Yeah,
you.
just some questions on the Albury cases, the death at Mercy Place and the other aged care facility. What is that other aged care facility that's currently experiencing outbreak here?
So look, we have to be really careful to protect the identity of COVID cases. So we don't usually identify particular facilities unless we're reporting a death. So let's all just respect the privacy of people who contract COVID and keep them safe. I think what's important for the community to know is that there is a risk to vulnerable people, and obviously people who are aged care residents are in a particularly vulnerable group.
Can I ask what's different? I guess when Mercy Place experienced the outbreak, we reported the name of that place. What's the difference in this situation?
So I think it was actually the facility themselves that notified that information. So New South Wales Health always follows protocols to protect the confidentiality of our cases. Yeah. Thank you. We might wind it up.
Yeah,
I think we've got other
Thank you.
commitments we have with the schools, but thank you all for
Thank
coming
you.
today.
Thank you so much for that.
Thank you.
Thanks.